Up front, today we're talking about what happens after bariatric surgery. That's the weight loss surgery where people lose a dramatic amount of weight. And that's a good thing, but what about all that skin that the fat was in? Well, a lot of times it's stretched and saggy, and that's where our plastic surgeon, Dr. Elie Levine, and his wife, dermatologist Dr. Jody Levine, come in. So good to see you guys again.
Good to see you too.
All right, so let's talk about that. I mean, you get these people come in after the surgery, they think it's going to change their life, right? They lose all that weight, but now they have another problem, don't they?
Correct, yes. Their health problems are oftentimes completely eliminated, but now they have just so much extra skin, and it affects everything from exercising, rashes, and their ability to wear clothing.
All right, so what do you say to people like that? Do you see them, do they come into you with skin problems first?
Sometimes they'll come to me for rashes that they get from the overlapping skin, and sometimes they'll actually even come for skin tightening procedures, but when your skin is that loose and so much excess skin, you need surgery.
All right, so that's your job to say, listen, I can't fix that. All right, so Dr. Elie, what do you do with all that skin, and where do you start? Because it's the whole body.
Correct. So the starting point really is what bothers a patient the most. And typically the most common area where people have concerns is around their waist and around their back, all the way around there. And one of the common procedures is what we call a lower body lift, where we remove a significant amount of excess skin. But the skin can be anywhere. It can be on your arms, it can be in your back, it can be in your chest, it can be in your neck, it can be in your thighs, you name it. And oftentimes, because for safety reasons, I stage these procedures where I'll do a little bit at a time.
Right, so you do like one procedure at a time, but it can be pretty dramatic. Now, we have a patient of yours. You change people's lives. I mean, fair to say?
Completely.
Right, he's
it's
done
amazing.
That.
They are the happiest patients.
All right, and we have someone who has a little something to say, a patient named Bridget, and we're going to roll that right now.
After having lost a significant amount of weight, you are left with a sizable amount of excess skin. And I wanted to be rid of that. I never wanted to walk into Lane Bryant again. Plastic surgery is difficult, and although you make the decision to do it because you want to aesthetically look better, it is a mentally, once it's over and the process is over, you just feel so free and you feel wonderful about yourself. This type of doctor experience, I think you only have once in a lifetime.
Okay, so now Bridget, we should say, lost 250 pounds from the surgery, right? From having the bariatric surgery, but then you took off another 60 pounds of
Correct.
Skin.
Yes.
I'm speechless.
You know, seeing a patient that happy, that's really what it's all about. Is I don't necessarily save lives, but the quality of life is really important too. And
right.
Seeing someone like that happy really makes a difference to me.
All right, we have some pictures of Bridget. I want to bring them up and we could talk about that. There you go. Okay, look at the before. I don't think people really realize how dramatic the sagging is of the skin there.
It's true.
Right.
People are shocked.
So if you're wearing loosely fitting clothing, you can hide that. But if you want to wear anything that shows off your waistline and your contour, all that extra skin that's hanging down from her back, actually, her upper back, is hanging all the way down and it's overflowing her bra. And by doing an upper back lift, I was able to recontour her waistline, address her upper back and lower arms, and she can wear normal clothing now.
Right, let's look at the next one. We have 4 of our photos. Let's say, there you go.
And this is a front view of her belly, and this had both functional as well as cosmetic ramifications to it, because that skin overlying her belly was hanging all the way down to her mid-thighs, and by addressing that, it took her down multiple dress sizes and allows her the freedom to exercise more regularly.
Yeah, I mean, let's go back and say that again, because I don't think it really hit as hard. The skin from the mid-belly went down to the mid-thigh.
Correct.
So just above the knees.
Correct.
That's incredible. All right, next picture. There you go.
And this is someone who had a combination of excess skin, but also has a lot of these folds and these adhesion points. And she'd previously had an incision along that midline area, so by using that old incision that she already had, I was able to tighten down and really give her body nice contouring. And she went down about 6 dress sizes from this, without changing that much on the scale. Maybe 10 pounds on the scale, but in terms of what she looks like in and out of clothing, that's really where the dramatic change came.
Right, and we got one more patient I want to put up there.
And this is someone, again, who had a circumferential tummy tuck or a body lift, and this had functional ramifications as well as cosmetic. She couldn't exercise. She felt like every time she got on the treadmill or tried to do a sit-up, that skin was just folding down. And she also went down, she actually went down about 8 sizes.
Wow, tremendous. All right, so now, Dr. Jody, we're talking about a lot of procedures, like Dr. Elie says, multiple procedures. Do you do things for the scars as well?
Yes. Well, most of his patients scar very nicely.
Well, of course, but a scar is still a scar.
A scar is still
not
a
in a bad
scar.
way, right?
And lasers are wonderful for scars. For elevated scars, I can inject with a steroid, and for red scars or brown scars, I laser. And we can get the scars looking really good.
Well, I got to tell you, based on those photos, I think they're pretty good, and she was very, very happy.
Makes it all worthwhile.
Yeah, all right, Dr. Elie, Dr. Jody, thanks so much for coming in. Really
Thank you
appreciate
so
it.
much.